Well, an EGD is actually an esophagogastroduodenoscopy, also known as an upper endoscopy, depending on who's talking about it. What it is we're looking at the esophagus, the stomach, and then the first portion of the small intestine. The reasons that we do an EGD are for multiple different things. One of them would be dysphagia, which is difficulty swallowing. Like if you were feeling like something was getting stuck in your esophagus, whether it be up here, in the middle, or down lower, that would be a reason to do it. Some people who have reflux, and that reflux is tried to be treated with medications, but it just isn't getting controlled well, that would be another reason. Or pain. Pain in the upper abdomen is a reason. Pain in the esophagus. Sometimes when people are swallowing, they'll have pain when they do that. We can choose between doing radiology studies versus doing an EGD for those type of things. Sometimes we start with a radiology study, sometimes we start with an EGD, depending on what's more available. What we're looking for is we're looking for any evidence of inflammation. We're looking for any masses or polyps, things like that. We're looking for ulcerations or erosions. The reason that we do the EGD is because there's possibly going to be a change in management of what we're doing with the patient. So we may need to adjust medications, we may need to try a different medication or add a different type of medication to the patient. The patient may ultimately need surgery depending on what we actually find, if there's a mass or something like that. Another reason we would do it sometimes is if a person is anemic and we don't know why, and they have an occult blood that is positive. That would be another reason. Dark stools, melena, that's also known as black tarry stools. That's indication that there's blood that has been digested, and so we would do an EGD for that as well. This is a pretty easy procedure to recover from. The one that we just did was a dilation. She has an esophageal stricture, which makes it difficult for her to swallow. We know that it's benign, and so we were able to dilate it today. She won't feel pain from that. If the patient does feel pain, that's something that we need to know about, because we need to investigate and make sure that there wasn't a perforation, which is one of the risks of doing a EGD, where there can be a tear in the lining of the esophagus, or in the stomach or in the small intestine. And so if a patient does have pain, we need to further evaluate at that point. When we have somebody who has something stuck in their esophagus, like a foreign body, if they have a stricture that they don't necessarily know about and they eat something and it gets lodged in there and we have to get it out, their risk for perforation does go up a lot at that point, but it's still pretty low.